Hello, this is Dr. Park. Today, I'd like to explain why breast augmentation surgery can cause pain and, more importantly, how we can make it virtually painless. Many people assume that breast surgery must be painful. How can it not hurt when you're cutting into the chest like that? I want to do it, but I'm too afraid of the pain. I'm sure many of you watching this video feel the same way. So the question is, does breast surgery really have to be painful? And if not, how can we minimize the pain? The key lies in how well we preserve the nerves responsible for pain. How do we preserve those pain-related nerves? By carefully avoiding damage to the fascia of the chest muscles, as well as the periosteum and perichondrium covering the ribs and cartilage, we can significantly reduce postoperative pain. Let me walk you through the surgical process using real images. This is a view of dissection performed through an armpit incision under endoscopy. The upper area is the pectoralis major and the lower part is the pectoralis minor. Between these two muscles, there is a layer of loose connective tissue and some fat. This layer contains very few pain nerves. However, the fascia of the pectoralis major and minor muscles is densely packed with pain-sensitive nerves. When we dissect precisely between these two muscle layers without damaging the fascia, we can preserve the nerves and reduce pain. As we go deeper, the pectoralis minor ends, and only the ribs and costal cartilage remain visible. This is where you need to be especially cautious. The ribs and costal cartilage are surrounded by periosteum and perichondrium, which are highly sensitive to pain. Ribs form a protective cage for the heart and lungs, and their outer layers are designed to detect even slight trauma to help the body instinctively protect itself. So, if we damage the periosteum or perichondrium during surgery, severe pain can result. To prevent this, I use a technique called sharp dissection, which allows for extremely precise tissue separation. By doing so, we avoid irritating or injuring the pain nerves, and that means significantly less pain after surgery. Even when creating the dual plane dissection, cutting the edge of the pectoralis major muscle does not cause pain as long as the fascia is preserved. To sum it up, pain from breast surgery can be avoided by carefully preserving the muscle fascia and periosteum through sharp dissection. We can greatly reduce postoperative discomfort. At UBA, I, Dr. Park, make it a priority to preserve these critical structures during breast augmentation surgery. My goal is always to minimize pain and discomfort for my patients. So please, don't worry too much about the pain. Thank you for watching.